Oops, this is. Oh, sorry. Okay, so how am I supposed to change this? Oops, sorry. Maybe. Okay, class. So today's lesson is about MRI. I think that day you saw some videos, might be confusing, but today let's go through about it. MRI is an application of what? Is an application of medical. The class, everyone can listen to me, right? Can see the PowerPoint, eh? Yeah. Okay, good, good. Sound is clear. Yeah. Sorry, let me check the sound. Okay, better now. Okay, so what is MRI? Okay, MRI is a full name is magnetic resonance imaging. Magnetic field is used to do resonance, and the resonance produces an image. It's MRI. It's a painless and safe diagnostic procedure. Okay, it uses a powerful magnet and a radio wave. Okay, the powerful magnet it uses is around 3 Tesla. Okay, I think 5 years ago, maybe I think they used 2 Tesla. Now currently we have 3 Tesla. Okay, so it produces a very clear image, very clear. Can't beat its technique. Okay, the competitor of this technique is of course CT scan, CT scan MRI. Those who can't go for MRI, they go for CT scan. But MRI is even better because of what? No radiation. Okay, it's no radiation. That's why we go for MRI. CT scan is full of radiation. We use X-ray. Okay, so clear image, and of course, because it's a technology and it's quite useful, and no radiation, it looks like it's very expensive. You go for one scanning might cost you about around, if I'm not mistaken, around maybe 1,200 to 1,500 a single shot of MRI. Maybe scan your brain is 1,500, your throat maybe another 1,500, and so on. Okay, yeah. So scanning is 1,500. You're going to pay 300 for the doctor to make his report. Okay, write a report. Okay. So those who are like to be in this class, like to be a doctor, I think, radiologist, I think, just sitting there, I think maybe 20 or 30 patients can do a scanning in a day. Okay, each scanning, the report he must write gives him around 300 ringgit. Okay, yeah. So you pay around 1,800 for one scan, including the report. Okay, so these are the scans looks like. Okay, so it gives a very clear image for the soft tissues. I think this the white color is actually the tumor, the brain tumor. If you have if the patient has a brain tumor, they give a different contrast. Okay, very clear contrast. So sometimes MRI, if they want to check blood vessels, then they might inject with you a contrast agent. A dye is injected before taking a MRI. Mainly, dye is required to check blood vessels, maybe blood vessels. We use contrast agent, like colon, checking colon cancers, check the blood vessels in there. You need to inject with a contrast medium. Okay. Okay. So the MRI scan is actually this how the scanning looks like. It's a slices of image. It's a slices of image. What I mean by slices of image, for example, what I can say is like let's say this your head, your face, okay, your nose, and okay, face. The MRI will take slices of image, every slice. It takes every slice. You take the first slice image will be shown here. Maybe this is the first slice image. Then the second slice image, the second slice image, third slice image, fourth slice image, and so on. Like continuous slices of image will be produced. Let's say the person has a brain tumor. Let's say here around a brain tumor. The first image will be normal. Second image will be normal. The third image will start to see some abnormality. You might see a dot or something. Then when go for more slices, you can see how big, how width is the tumor. Okay, everything can be checked from these scanning techniques. Okay, so by changing exam parameters, the MRI can cause tissue in the body to take a different appearance. This is helpful to the radiologist. Determine if some scene is normal or not. For example, can see arterial system in the body without a tissue around it. Okay, so it's slices of scanning, slice images. Okay, you go to the hospital, this is how the MRI looks like. You go to the door outside, they'll put the magnet sign. Put like a magnet, you know, they put a magnet sign stating it's MRI. Okay, you go for the CT scan. You go to CT scan, the front door they put the radiation sign. You know, the radiation sign like this. The three boxes, radiation sign. Okay, but if they never if they never put it, this MRI, this CT scan, and MRI machine looks the same. It's like a donut shape. Okay, so you must understand, MRI is not for everybody. Not everyone can go MRI. Okay, maybe some of you might have, maybe you have an implanted medical device, or you have a heart pacemaker, or you have an inner ear implants, or maybe you did a surgery, the bone surgery, and you place a metal inside to connect bones or something. Then you can't go for MRI. Why? Mainly the pacemaker, the heart pacemaker. Why you can't? Because inside the heart pacemaker there is current is flowing, and you apply with a huge magnetic field of 3 Tesla in the MRI. What will happen? Force will be exerted. The pacemaker will come out from your body. Okay, so you can dial. So that's why anything. If you have a metal in your leg, and you never mentioned that you have a metal inside your leg, and you go for MRI, when the 3 Tesla is applied, your leg immediately going to stick to the magnet. Okay, and not stick. The magnet is quite far away. You might float to that side. Okay, so going to cause injuries. So those who have implanted metal or any pacemaker inside, sorry, you can't go for MRI. You have to go for CT scan, and you take up lots of radiations. CT scan for 1 or 2 scanning in a 6 months period is okay, but not frequent. But of course, it damages the tissue because that's X-ray. MRI so far, no side effects. Okay, this magnet. Okay, those with the metal close in an important organ, for example, metal in the eye, possibly an injury, or metal clips in the brain, following treatment from brain aneurysm. So pregnant ladies are, so far, we never use pregnant ladies scanning by using MRI, because for pregnant ladies, I think ultrasound does a very good job. Ultrasound, another type of scanning. We're just using a sound wave to send the sound into the pregnant lady, and what you call the echo produces can use to check the fetus development. Okay, ultrasound does a very good job, so we never go for MRI. We can use a pregnant lady under MRI, but we don't know the side effect yet, so we don't want to use now because ultrasound does a very good job. Okay, so keep all metals object away from the scan room when you get into the MRI. Okay, the full loaded parallel jack sucked into the bore of MRI system. The magnetic strength is so huge, 0.52 Tesla, but now we've got 3 Tesla already. Okay, credit card and bank cards, if you bring into this huge magnetic field, it can erase the cards. Let's say you bring a hard drive inside, are you going to erase the data? Okay. So the structure of the scanner, it has a cylindrical permanent magnet. There is a cylindrical permanent magnet, and the Gridin coil provides a variable magnetic field. There is some Gridin coil, so another non-uniform magnetic field, now we call it, to produce a different magnetic field at a different part of the body. Why? We will get to know in a few slides later. And a radio frequency coil is there. So these are the three components. Permanent magnet, cylindrical, which is 3 Tesla. And you have a Gridin coil inside. It's a produce a non-uniform magnetic field. A different part has a different magnetic field. And third is a radio frequency coil. A radio frequency coil will causes the resonance to the hydrogen atom. Here is the rough sketch. So permanent magnet, and you have a non-uniform magnetic field, the Gridin coil, non-uniform magnetic field. The patient, the box is the patient. Okay, imagine. And this is the RF coil surrounding the patient. And the RF coil will send a signal. Then later, the atom release some sort of energy. The energy is captured in the RF receiver, processed and displayed. The image will be constructed. Okay. Okay, this I skip this first. Okay, as we go to the theory. Okay, something called precession. Precession. The human body is made up of billions of atoms. You know that the fundamental building block of all matters. The nucleus of an atom spins or precesses. The nucleus can spin like a top. The nucleus can spin like a top. Okay, in every atom, you can think of nucleus of an atom as a top spinning somewhere of its vertical axis. The nucleus. We normally talk about the electron movement, not the nucleus movement. They say nucleus also can spin like a top in a fixed axis at the bottom. Okay, all the atom can spin, but the one we focus is hydrogen atom. Okay, MRI scanning focus the hydrogen atom. Why hydrogen atom? Of course, your body is 70% of water, so a lot of hydrogen is abandoned in your body. That's why we focus hydrogen atom. Okay, imagine billions of nucleus all are randomly spinning and precessing in every direction. There are many different types of atoms in the body, but the purpose of MRIs, we are only constants on the hydrogen atom. Okay, we focus to hydrogen atom. It is an identical MRI. Okay, because its nucleus has a single proton and large magnetic moment. Yeah, it has a very large magnetic moment. Really can spin fast because of what? A large magnetic moment. Why large magnetic moment? Because hydrogen only made of one proton and it's quite light. Easy can be influenced by a magnetic field. Can turn very fast because it's very light. If you go for a helium or something, an atom which has a big nuclear number, then it has a low magnetic moment because magnetic field difficult to make it turn because it's heavy. Okay, it has a low magnetic moment, we call it. So the most lightest element we know is atom, hydrogen. So we use hydrogen because it has a large magnetic moment, easily can spin to the effect of the magnetic field. Okay. The large magnetic moment means that when the place is magnetic field, the hydrogen atom has a strong tendency to line up with the direction of the magnetic field. Okay. So this hydrogen atom at the beginning is positioned randomly. Whenever you never give a magnetic field, the hydrogen atom will be oscillating, will spinning at a different axis. One axis will be this way, another axis might be this way. So randomly, but when you give a magnetic field to the northerly direction, all hydrogen atom will align to the direction of the north. They are parallel. Some may be pointed upwards, some can be pointed downwards, but they will be parallel to the magnetic field center. Okay. Inside the bore of scanner, the magnetic field runs straight down to the center of the tube, which plays a equation. The hydrogen proton is line up direction of the feed to up 8. The vast majority of this proton cancel each other out. Okay, only a couple of proton out of the millions are not cancelled. Okay, if you've seen the earlier videos, some low energy hydrogen is the one we focused. Okay, the one we focused because okay, sorry. So let me show a diagram. Yeah. Okay, let's say this is a human body. Human body. Okay, is in the MRI. Okay, the hydrogen atoms are randomly distributed. When you give a magnetic field like this, horizontal magnetic field, because it's a donut shape, it's a donut shape. Let me go to the. Sorry, let me go to the whiteboard. Okay. So the patient is here. Okay, the patient is here. Let's say. Okay. So the magnetic field is in a donut shape. Okay, it's like this. Okay, it's a big round. Okay, like a donut shape. Okay, so it's like a coil. It's like a coil. So you're going to produce a magnetic field. Which region? The magnetic field going to be this way. It's going to be like this. Okay, the magnetic field going to be like this, and coming out here. Okay, magnetic field going to be like this, coming out. Yeah. So maybe this is the North Pole or South Pole, like because it's like a coil. So when the magnetic field enters into your body, what happens? All your hydrogen atom will start to align. All of them will start to align in your body to one direction. Okay, they will align. Okay. So when you give RF signal, the hydrogen atom will start to spin with the maximum amplitude. They will start to spin with the maximum amplitude, like a top. They are going to spin with the maximum amplitude by absorbing this energy. This is called resonance happens. Now the question is, why RF signals used to resonate the hydrogen? They found that when resonance happens when the frequency of the driving force. Yes, the RF signal is the driving force. This is the driving force. The frequency of the driving force matches the natural frequency of the oscillating system. Who's the oscillating system here? The hydrogen. The hydrogen. So the RF frequency, the natural frequency of the hydrogen is found to be under RF region, radio frequency region. That's why radio frequency has been used. Okay. So here, when the resonance happens, the hydrogen will be oscillating with a big amplitude. When the RF signal is stopped, what happened? That hydrogen stop oscillating, and stop oscillating, it give up energy, certain energy. Some energy is released. The system captures this energy and used to process the image. Okay, used to process the image. Okay, so this is the fundamental ideal. We use a strong magnet to make all the hydrogen to be aligned. Okay, then we use the RF signal to make the hydrogen atom to experience resonance, oscillate with a big amplitude. Then when it stops oscillating or rotating, the energy will be released, the excess energy will be released and will be used to process the image. Okay, any questions from here so far? Okay, we go back to the slide. Okay, that's the idea, radio frequency. Okay, the MRI machine applies a radio frequency pulse that is specifically only for the hydrogen atom. The system directs the pulse towards the area of the body we want to examine. The pulse causes the proton in the area, absorbs the energy, make them spin. We call precise happen. This is called, we say, resonance part of the MRI. Resonance happens. And the RF pulse force them, the 1 or 2 like unmatched proton per million to spin at a particular frequency, a particular direction. The specific frequency of the resonance is called Larmor frequency. Yes. There is a special name for the natural frequency here. The special name given for the in MRI is called Larmor frequency. Larmor frequency is actually the natural frequency of the hydrogen atom. The frequency required for it to spin. But this Larmor frequency got special character. Larmor frequency not only depend to the type of tissue. Okay, the Larmor frequency not only depend to the type of tissue. For example, hydrogen not depend to the type of hydrogen only. It also dependent to the strength of the magnetic field. So the Larmor frequencies depend to two factors. Not only for hydrogen it determines the Larmor frequency, the magnetic field strength also determines the Larmor frequency. This is a very good news for us, because the Larmor frequency not only affected by the hydrogen, it's also affected by the magnetic field strength. Why I say it's a good news for us. Okay, why the good news? Okay, let me show you back. Okay, why it's a good news? Okay, the good news is this. Let's say, again, I draw the body. Okay. Let's say they just make all the hydrogen atom align, okay, all the hydrogen atom line, okay. They shine the RF signal, okay. Then if they stop the RF signal, then all the hydrogen atom will be like what spinning, precession happen. After stop RF, they stop spinning, they give out energy. But the energy comes out, the energy received by the detector, the detector cannot visualize which energy is for which atom. Is it from the top? Is it the signal receiving is at the stomach? We don't know, because there are billions of hydrogen atom here. Okay, billions of signals are going there. We don't know which signals by which hydrogen atom, which part of the body. Okay, so what they did, they do like this. Okay, so you want to is the head, you want to take the image. First, what you do, we take this slice first, this slice. Okay, when I view from here, okay, let's say they want to take this signal first. They want the signal from the top, the forehead hydrogen first. So what they will do, they know the Larmor frequency, They know the Larmor frequency is affected by what? Affected by the hydrogen atom, and also the magnetic field strength. This is a good news. I say it's a good news because of what? Now what they do, they make this, let's say, to Larmor frequency required for the hydrogen atom is, let's say, the magnetic field strength required, let's say, is 3.2 Tesla, let's say, 3.2 Tesla. Okay. Sorry, not 3.2 Tesla. Say I put 2.8 Tesla, better. I say the Larmor frequency required, the magnetic field required to achieve that Larmor frequency, let's say 2.8 Tesla. So what the technician will do, or the doctors, the MRI technicians, they will do, okay, they put only this region, they put only this region to have 2.8 Tesla. Okay, other regions they put a magnetic field of different 3 Tesla, maybe a 2.6 Tesla, 2.5 Tesla. Other regions they put not 2.8, they put maybe other Teslas, maybe 2.2 Tesla. So this done by using a non-magnetic field. Maybe the uniform magnetic field provide let's say 2 Tesla, let's say 2 Tesla, the uniform magnetic field produces 2 Tesla. The gradient non-uniform magnetic field here, it applies another 0.8 Tesla, make it 2.8 Tesla at this point. It's called gradient coils. Gradient coils make here 2.8 Tesla, here increase the magnetic field strength. The magnetic field strength at every specific point is actually the combination of magnetic field strength of the uniform magnetic field plus the magnetic field strength of the non-uniform magnetic field. There are two magnetic fields inside in the MRI. Uniform, which the donut shape, the big magnetic field. Another one is the non-uniform. Non-uniform is just applied the specific point so that only that hydrogen atom at that point experience the specific magnetic field strength, which lead to Lamo frequency. So now what they do? Now when they send the RF signal, only this hydrogen atom here will precess. Other hydrogen atom here or hydrogen atom here won't spin. They won't spin because why they never spin? They never achieve the 2.8 Tesla of magnetic field. They have a different magnetic field. So only this hydrogen atom, 2.8 Tesla, will experience resonance, precess, and the RF signal is stopped. The hydrogen atom will stop spinning, then called relaxation time. Relaxation time means the hydrogen is stopped precessing, come to the equilibrium stage, energy is released. So the doctor know the energy released from the brain, this the picture of the person, cross-sectional area. They know the signal reaching is the one, this region, something this region, first region. So they start to draw the software start to draw the image over there. Okay, then after that, what they do, they want the entire slice of the image. So what they do now? Now the 2.8 Tesla will be adjusted to the following region, maybe the region at the bottom here. They repeat the same step. They release the RF signal, let precession happen for the adjacent hydrogen, and they stop the RF signal. That hydrogen will release the signal. They got the following image. So all the images will be collected one by one until maybe in a few 1 minutes they can collect one slice of image. Okay, this is why I said why it's good news that Lamo frequency is independent to the magnetic field strength. Okay, if the Lamo frequency is not dependent to the magnetic field strength, we can't form the image. We cannot. The MRI won't work. We can't develop the MRI because of what? You shine the RF, all hydrogen atom will precess and release the energy. So if B if it's not affected by the B, thank God it affected by the B. That's why we can give a different type of magnetic field, different region. The point where you want the image to be the image to be found, then that point we apply the correct magnetic field, which led to the Lamo frequency. Okay, any question from this explanation? Okay, so I go back to the slide. So you see the RF pulse. Okay, the RF pulse form them spin in a particular frequency. The specific frequency is called Lamo frequency, and it's calculated based on the type of tissue and the strength of the magnetic field strength. The RF pulse are usually applied through a coil. MRI machine come with a different coil design for the different part of the body. Knees has a different RF coil, shoulder has a different RF coil, and so on. Okay, the gradient magnets. Gradient magnets is the type of magnet which produces a non-uniform magnetic field. Non-uniform magnetic field. I told you this already, right? The uniform magnetic field, let's say you give 2 Tesla. The non-uniform magnetic field at another 0.8, let's say 2.8 Tesla is required for the Lamo frequency. The 0.8 is applied by the non-uniform magnetic field, the gradient magnet. 3 gradient magnets are arranged in such a manner inside the magnet, turn on and off very rapidly. They alter the mean magnetic field on a very local level. The magnetic field is changed. Can pick exactly which area we want the picture. The MRI pick slices. Think of a load of bread with a slice as thin as a few millimeters long. We can slice any part of the body if you like, giving a huge advantage of the MRI. Okay. So hydrogen proton, when RF pulse is turned off, the hydrogen proton begins to slowly slow down, return to their natural alignment, release their excess stored energy. Okay, when they do this, they give off a signal. The signal is the one picked up. What is the system receive? Is they use a mathematical data. You only know this extra information. They use a Fourier transformer Those who want to do maths in the universities, you might learn about Fourier transformer. It's a kind of calculation which calculated to create the image. Okay. Yeah. So this is how the MRI works. Okay. MRI works based on strong permanent magnetic field, uniform magnetic field, non-uniform magnetic field, RF coil required. Okay. And of course, computer. So MRI is recommended by the doctor for, I think, every type of diagnosis. Nowadays, they go for MRI. Okay. Why? The main reason why MRI, because no radiation, it's safe to use, and its image is super clear. Okay, super clear. Yeah. So now let's talk about what is the advantage of MRI. Why MRI is advantage best scanning compared to CT scan? The main reason I already told you, because you do not use ionizing radiation. Okay, never mutate yourself. You can go 10 or 20 times of MRI scanning in a month. It's not going to damage your body. No radiation. Another major advantage of MRI is the ability to image in any plane. You can put any plane. You want the vertical plane or you want the horizontal plane, you can take the image. The software can adjust. An MRI system can create external images as well as images, any views. Okay. Difficult for CT scan. CT scan, you can't do that. One slice only, one plane only. Okay. Okay, so if you ever add an X-ray, you know that every time they take the different picture, you have to move. The 3 gradient magnet discussed earlier allow the MRI system to choose exactly where the body to acquire the image, how the slices are orientated. Yeah, the size orientation is done by the gradient magnets. Okay, although the MRI looks so good, advantage is radiation, and no radiation. But other than that, a lot of disadvantages also MRI. The first disadvantage is not everyone can go for MRI. You got any medical implant in your body, you can't go for MRI. That's one disadvantage. CT scan, you got metal, you don't have metal, you can go for CT scan. Okay. Second, there are many claustrophobic people in the world, and being in MRI machine can be very disconcerting experience for them. Third, makes a tremendous amount of noise. Yeah. Anyone have been to MRI here in this class? I've been to MRI. Okay, I got a neck pain, so I think I got a problem with my neck. So a few years back, 2 years ago, I was hospitalized. I went for MRI. For the first time experiencing MRI, took about 30 minutes, the scanning. And I heard a lot of noise. Yeah, a lot of noise. The electromagnet noise, I think. The electromagnet noise. You can't stay inside without a earplug. You must have an earplug. Okay. If not, it's so noisy. The noise sounds like a continuous hammering sound. Yes, sometimes hammering sound. Patients are given a earplugs normally, or stereo headphones to muffle the noise. The noise is due to the rising electrical current in the wires gradient magnet being opposed to the magnetic field. The electromagnet causes the noise. Okay. So that's one disadvantage, tremendous noise. Okay. And okay, and the worst part is the third point, disadvantage. The MRI scans requires patient to hold still. You have to stay still, for at least 20 minutes to 90 minutes or more. I stayed still for 30 minutes because they want to take a picture of my neck and brain. So they place my head and my neck into a mold, a kind of a mold, so that I can't unable to move around. I have to stay. I have to view. I have to always face top. My face is to the facing the ceiling. I cannot turn it to the side because the mold is such a way that hold your head not moving. Okay. But let's say during image, you start to move a little. What will happen? No, it's not any harm for your body, but the image is going to be distorted. The hydrogen atom, the precession and everything won't happen properly. So the image will be distorted. So what they will ask you to do, take the image again. So you're going to spend another 30 minutes and you're going to pay extra another 1,500. Okay, so very pricey. So when you go for MRI, make sure you stay still for 20 to 90 minutes so that you never pay extra and only one shot line up, you get the imaging. Last time it used to be very long, about close to 90 minutes, 1.5 hours stay still is not easy, not a very easy task. But now with 3 Tesla, I think the timing gets shorter. They get the image very fast. Okay. And the orthopedic image hardware costs severe. Yeah, orthopedic hardware is also unable to cost you to go for the what you call scanning MRI. And finally, of course, another factor is very expensive nowadays. Last time was 1,500, now it's getting cheaper, but still above 1,000. Okay, different hospital give a different price. The cheapest, I think I found in Tung Shin Hospital, I think around 900. I think one MRI scan, if I'm not mistaken. Okay. Any questions so far? Okay, in exam you have to know advantage and disadvantage. Advantage only one, no ionizing radiation. That's the only one advantage. Disadvantage got a lot, but still we make MRI is good because of the 2 advantages actually. No ionizing, never damage your body. Second, the image is quite clear, very reliable. If they found that MRI, the brain tumor is 3 centimeter, when they do the surgery, the size of the tumor is around that 3 centimeter, maybe 3.1 centimeter or something. Not much of a toleration, very small toleration, quite accurate scanning. Okay. Okay. So future of MRI. MRI is limited only by our imagination. It's just a very recent technology. I think mid of 1960s, if I'm not mistaken, it's not even 100 years. Okay, compared with X-ray, which is more than 100 years. Okay, now what they are trying to develop is they're trying to develop a small scanners for imaging specific body parts and being developed. Okay, MRI cannot fit into a ambulance. Okay, the machine is too big, not fit into an ambulance. So they're trying to make small scanners nowadays. Okay, and so on. Then our ability to visualize the artery and system is improving all the time. The functional brain mapping and so on. Okay, the current MRI system looks very, very accurate, very more precise. Okay, the technology is improving. Okay, class, whatever it is, whatever long story I told you, okay, to be in short, the only thing you need to remember for the exam is these points, these 8 points. Okay, these are the 8 points you need to memorize. What I say, you need to memorize. Okay, in exam, if you see the past year papers, magnetic field comes out, it's going to be a 6 to 8 marks question. 6 to 8 marks question, just explaining how it works, like this. Okay, outline briefly the main principle of the use of magnetic resonance to obtain a diagnostic information about the internal structure. 6 marks question. So this is the fact you have to remember. So there are 8 points actually. First, a large magnetic field applied along body, RF pulse is applied, 1 mark. Causes hydrogen nucleus or protons to resonate. Hydrogen 1 mark, to resonate another 1 mark, 3 mark. Okay. After the RF signal is stopped, the nucleus return to equilibrium state or relaxation time, 1 mark. It releases the excessive energy releases a RF pulse emitted, 1 mark. the pulse is detected, processed, and displayed. 1 mark. Yeah, this is 6 marks. Then the resonant frequency depends on the magnetic field strength, the Larmor frequency. The Larmor frequency depends on the magnetic field strength, 1 mark. So non-uniform magnetic field is used to locate the nucleus which emitting the signal. That is 1 mark. Okay, in other words, you don't need to read the entire slide I give you. You need to remember these 8 points. If these 8 points is the one they're going to ask in exam. MRI, good news, no calculation. Just remember the fact how it works from the beginning. Then uniform magnetic field applied, then RF signal is applied, hydrogen atom will start to resonate, precession happens. When RF signal is stopped, you come to the relaxation time, RF signal is emitted, the RF signal is detected, processed and displayed. And to locate the cell, the Larmor frequency depends on the magnetic field strength. So non-uniform magnetic field is used to locate the cells. Okay, class. So this is how the questions are repeated again, 8 marks. Long, strong magnet is used. Rotate about the direction of the field. Radio frequency passes, cause the resonance of the nucleus. Is Larmor frequency is at the Larmor frequency. On relaxation, nucleus de-excite, detected and processed. Non-uniform field is used, superimposed, allow for position of nucleus to be determined. And the location detection be changed. Okay, so that's all about MRI. Any questions? So this is the end of the magnetic field topic. Anyone have any questions? Anyone can listen? We're still connected, right?
Yeah.
Okay, I'm afraid. Okay, so let me show another video to understand the MRI. This is another one. Okay. Yeah, watch, please.
Magnetic resonance imaging, commonly known as MRI, helps doctors find, watch, and treat medical problems. MRI uses very strong magnets, radio waves, and a computer to make pictures of the inside of the body. MRI pictures are more detailed than those made with other methods. There are many reasons to have MRI. MRI may find bleeding, such as bleeding in the brain. Brain changes, as in stroke. Problems with your back, such as a herniated disc. And an injury inside the body, such as a torn anterior cruciate ligament. Before MRI, you will remove all metal objects. And it's not safe to have MRI with some medical implants. You should tell the MRI technologist about any metal, device, or implant you may have in your body, such as a pacemaker. To prepare for MRI, you will lie on a table just outside the scanner. MRI scanners are very noisy, so you will probably wear earplugs or headphones. Different equipment, such as pillows and straps, will help you stay in the correct position. Once you are ready, the table will slide into the scanner. Most often, closed scanners, such as this one, are used. The area inside is very narrow. In some areas, open scanners are available. This scanner is open on the sides, so you won't be completely surrounded by the machine. However, the pictures may not be as good as with closed scanners. For either type of scanner, a technologist will operate it from the next room. You will be able to talk to each other through a two-way speaker. During the scan, magnets in the machine will create a strong magnetic field. This will not harm you. Then, the scanner will send radio waves through your body. This will not harm you. When the radio waves are turned off, the scanner will pick up energy signals from your body. These signals are used to make the pictures. During the scan, you will have to stay very still so the images will be clear. You may be asked to hold your breath for a short time. MRIs may take 30 to 45 minutes or longer to complete. In some cases, you may get contrast dye with your MRI. The dye helps make clearer pictures. After the MRI, you can resume your normal activities. If you received contrast dye, the technologist may ask you to drink plenty of water or other healthy drinks to help your kidneys remove the dye from your body.
Yes.
Okay, class.
Excuse me.
すみません。
Okay, class. Sorry, I just disconnected just now. Can you hear me?
Yeah.
Okay. Okay,
Yeah.
class. So just now you can see the video, right? You saw the video just now?
Yes.
Yes. Okay. Right, class. So that's all about magnetic field. That's all about magnetic field. So you do the past years. Okay. Tomorrow we're going to start with a new topic. We start with the alternating current. Okay. If you don't have questions, we can stop here.
Okay.
Okay, class. So no questions. Okay then. See you tomorrow. Thanks.
Thanks, sure.